Yeah.
Today we have Dr. Rafeeque sir. Doctor is consulting physician and cardiologist at Pulse Hospital, Nanded. Sir having 25 years of experience in diabetology, hypertension, asthma. Doctor participated in various national and international conferences like Epicon, Mapicon, CAD, and CSI. Sir also part of 2014 held at USA, WCC 2015 held at Australia, also delegate of ESC 2018 Germany. Sir presented 4 papers in various international journals. Sir also active on social media for patient awareness campaign like diabetes, hypertension. Sir have own channel on Facebook, YouTube and Instagram. Sir will take us through 7 important self-care to manage diabetes.
Yeah.
Over to you, sir.
Thank you very much for my kind introduction. Thank you. I welcome all the delegates who are watching me on Facebook, and also must be some people watching me on YouTube also. So friends, the topic given for CME to me today is being active as an important self-care behavior to manage diabetes. This is my hospital, Pulse Hospital, situated in Nanded, from where I am delivering this talk. We all know, friends, diabetes is a complex and serious disorder, and handling it very in our day-to-day life can be of a great challenge. But small changes in your daily routine that can help you handle this problem smoothly. So the Association of Diabetes Care and Education Specialists has defined 7 self-care behaviors as a fundamentals or as a framework for patient-centered diabetes self-management education and training and care. And this each behavior refers to the decisions and actions that you can take to tackle with this disease and control the blood glucose levels. These very important 7 self-care behaviors which are essential for successful and effective diabetes self-management, they are: number 1, healthy eating; number 2, remaining being active; third is regular monitoring of blood glucose; fourth one is taking medications; fifth one, problem solving; sixth is reducing risks; and last one, seventh, is healthy coping. So in today's CME, it is very difficult to cover all the 7 self-care behaviors because of the limitation of the time. So we will focus our talk today for only being active, this self-care behavior. Friends, in all the public or in patients with diabetes, pre-diabetes, acceptance and maintaining the physical activity, it is very important for blood glucose management and overall their health. Recommendations and precautions, they vary depending upon individual characteristics and individual health issues of the patients. In today's talk, we will try to understand about physical activity or exercise programs, and we will know the recommendations regarding it in diabetic patients. By the way, any patient can follow these. They are applicable to all kind of public above the age of 40 years, but especially diabetic patients we are more concerned with in today's talk. When it comes to physical activity and exercise, we are often confused what is physical activity, what is exercise, whether they are same or is there any difference. So my dear friends, physical activity is a general term, very much broad term, and it includes all the movements, all sort of movements that increase energy use, and it's an important part of the diabetes management plan. Whereas exercise is a more specific form of physical activity that is structured and designed to improve the physical fitness. So both physical activity and exercise, they are important, and they should be tailored to meet the specific demands of each individual. There are a lot of benefits of regular exercise. We don't need to go into the details, but mainly in diabetic patients, they are improvement in the blood glucose level, and it contributes to good weight loss, and it reduces cardiovascular risk factors, and it improves well-being also. apart from other benefits also, like improvement in the sleep pattern, improvement in the digestive system, improvement in the cognitive behavior, and there are lot many benefits of doing regular exercise. When it comes to the types of exercise and physical activity, my dear friend, they are divided into mainly four categories: aerobic exercises, resistance or strength exercises, flexibility exercises, and balance exercises. So what do you mean by aerobic exercises? These exercises, they involve repeated and continuous movements of large muscle groups. Activities like walking, cycling, jogging, and swimming, they are all aerobic activities. Whereas in strength or resistance training, they are done with the help of free weights or weight machines or body weight or elastic resistance bands. They are also called as resistance training or strength training. Then third one is flexibility or stretchability. It improves the range of motion around the joints. And fourth one is the balance, and the balance has the advantage of maintaining a good gait and preventing the falls. Friends, activities like Tai Chi and yoga, they combine all the flexibility, resistance exercises, and balance activities. What are the ADA recommendations for the exercises in diabetic patients? So first recommendation is 150 minute or more of a moderate to vigorous intensity aerobic activity per week. It should be spread over at least 3 days per week. I mean, you should not complete the 150 minutes in only 1 minute in 1 day or 2 days like that. You should at least take 3 days to complete the quota of 150 minutes. And in that 1 week, there should not be more than 2 consecutive days without activity. More vigorous intensity activities should be performed for minimum of 75 minutes per week. They are basically this kind of activity, vigorous intensity activity is designed mainly for younger and more physically fit individuals. It is not recommended for older individuals. So all the aerobic exercises like walking, swimming, cycling, and running, they should be performed for at least 150 minutes per week. Or if you are younger and fitter, then you can go for 75 minutes per week of vigorous high intensity exercise. Recommendation number 2, 2 to 3 sessions per week of resistance exercise on non-consecutive days. Means you should not go on performing weight training or resistance training for consecutive 2 days. You can perform it in 2 or 3 sessions divided over a period of 1 week. They include exercises with, as I said, free weights, with weight machines, body weight, or elastic resistance bands. Recommendation number 3 is all adults, particularly those with type 2 diabetes, should decrease the amount of time spent in daily sedentary behavior. Sedentary behavior includes prolonged TV watching, prolonged sitting with the smartphones, prolonged sitting with chit-chatting with the friends, book reading, etc., etc. Prolonged sitting is it is regarded as a passive smoking and should be interrupted every 30 minutes for good blood glucose benefits. Recommendation number 4, flexibility training and balance training. They are to be performed 2 to 3 times per week. It is mainly recommended for older adults with diabetes, not for the younger, fitter people. Yoga and Tai Chi may be included based on individual preferences to increase this flexibility, muscular strength, and balance. So, in a diabetic patient, if you want good glucose control, then you need to interrupt the prolonged sitting. You need to go for post-meal 15 minutes walk. You need to go for mild 3 minutes of light walk every after 30 minutes if you really want a good glucose control and if you are suffering from diabetes. Many patients ask me whether diabetes is a reversible or can we prevent the diabetes. I simply say, also the recommendation by the ADA is also suggests this, You should go with 150 to 175 minutes per week of physical activity and dietary restriction up to the tune that you get the desired weight loss of 5 to 7%. Then only you can retard the progress of diabetes, you can prevent or you can delay. So these are the structured lifestyle interventions. Whenever any individual wants to postpone the diabetes or want to prevent it, then he or she should follow these two strategies. Now, what are the key techniques, behavior change strategies for adaptation of physical activity? Prompting the patients or stimulating the patient to hang on with the exercise is very difficult in diabetic patients. So you can tell them, you can advise them, you can prompt focus on their past success, you can promote, you can use follow-up prompts, and you can identify the barriers or problems which are interfering. You can provide with the good information whenever possible to perform to the individual, and timely you need to prompt review of behavior goals is to be done. Few words regarding pedometers or step counters. Nowadays they are widely considered as a widely studied behavior change tool. So wearing this pedometer may prompt activity to the individual, and it provides feedback for self-monitoring. Pedometer use in adults with diabetes type 2 increases their daily steps. Using a daily step goal, for example 10,000, is predictive of increased participation, even using self-selected step goals. Thus, adults with type 2 diabetes should initially set achievable target for steps per day before progressing towards higher goals. And adults should avoid doing less than 5,000 steps, and they should try to strive for, and they should try to go above 7,500 steps per day. My recommendation is they should go up to 10,000 steps per day. There are some technology based strategies also for adults with type 2 diabetes. Internet derived physical activity promotion interventions may be more effective than usual care. These programs, they include monitoring of physical activity, feedback, goal setting, and support from a coach via phone, email, WhatsApp, or other social media platforms. How will you overcome the barriers to physical activity? Friend, this is the biggest challenge we encounter in our day-to-day practice whenever we deal with the patients of diabetes. First and foremost, most of the diabetic patients, they tell, I don't have time to exercise for 30 minutes a day. Tell them to make physical activity as a part of their routine. For example, walk or take the help of bicycle to the work or to the shop they want to go. Exercise while you watch TV. Tell them to take the stairs instead of the elevator, or do something active with your family to spend time together. Tell them to think about your day. Ask them, do you have available time slots? If you find yourself waiting for the kids, for example, to finish practice or watching the game for the sidelines, use that time. Tell them to use that time to take a walk or pace while you watch them. Tell them to do as much as they can. Every step counts. If you are just starting out, start with 5 to 10 minutes a day and add more. Little by little. You can also try for 15 minutes sessions twice a day. Second barrier is, many people they tell, I have never been active. Don't discount your everyday activities. You may be more active than you think. Housekeeping or mowing the lawn, it counts as activity, my dear friends. If you have never been active, have not been active for a while, it is important to start slowly. If you feel unsure about your health issues, check it with your healthcare expert before making big changes in your exercise plan. Choose the activities that you are happy with, that you enjoy. Over the time, the activities you do will get easier. You will even find that you can increase the duration and or the intensity of the activities which were unlike which you were not earlier preferred to do. Third barrier is people they say I am too tired after work. You can tell them to do the exercise before going to the office, or they can try walking for 30 minutes during the lunch break a few days a week each week, or hitting the gym early in the morning. They can utilize that time. Remember that increasing the amount of physical activity you do will actually increase your energy. What you feel after getting your job or coming from the work, you feel too tired, but actually uh, after performing the exercise you will find increased energy in your body. Fourth barrier is people they say I am afraid I will make my condition worse. Remember that getting enough physical activity is important for everyone's general health, whether you have diabetes or not. Remember that exercise helps lowering your A1C, HbA1c, and it has many more health benefits. If you have certain health related issues from or some complications from diabetes and you are not sure about your health, go and talk to your doctor before making any big changes to your fitness routine. Fifth excuse is they say I am too shy to exercise in a group. So you can tell them to choose an activity they can do their own, such as following along with an exercise video or going for a walk alone. You should remember that the everyday activities you do on your own, like gardening and household work, get you moving and it gets you moving and help you burn more calories. Whereas sixth is I don't want to have sore muscles. Friends, exercise shouldn't hurt if you go slowly at first. So you choose something you can do without getting sore. And you should make sure you warm up and cool down. It's very important before starting the exercise program. You should get yourself warmed up first. You can get stretch your body first, and after the completion of your workout, you can cool down for a few minutes. So it will prevent your soreness of the muscles. Next barrier is I am afraid my blood sugar level will drop too low and I may land up into hypoglycemia. Friends, you can wear diabetes ID if you are suffering from diabetes. It's an important safety precaution. Always those you should be prepared while doing exercise for low blood sugar level problem. You can keep with you some regular glucose biscuits or some sugar candy, fast acting carbohydrates to treat low sugar if one should occur. And mainly the people who are type 1 diabetics and those who are on sulfonylureas or on insulin, they can have the risk of developing low blood sugar level while doing exercises. Last barrier is people they say I don't have the motivation to exercise. So they can tell them remember all of the benefits that come with being physically active. Tell them the importance of benefits of exercise. Tell them to invite a family member or friend to exercise with them, so that on regular basis, so they can enjoy exercise group in class also, or as in community also, in class also they should make a plan, so they can decide when we will do each type of activity. Be sure to set realistic goals and make a plan, so you know that you are working toward. Now, exercising with health related complications is a big issue. There are certain health related complications which are seen in the diabetic patients. With those problems, exercising sometimes it becomes challenging. So most of our diabetic patients, they have eye issues in the form of retinopathy, cataracts, or glaucoma, etc. Those individuals with mild to moderate retinopathy, the recommendation is with milder form of retinopathy, all activities are permitted. And mild retinopathy people, they should undergo yearly fundoscopy to monitor their progression of the retinopathy. Those with moderate non-proliferative retinopathy, they should avoid heavy exercising or avoid activities that dramatically elevate their blood pressure, powerlifting and all. Similarly, those people who have severe unstable retinopathy, they should avoid activities that dramatically elevate their blood pressure, such as vigorous activity of any kind. They should avoid vigorous exercise, jumping, head down activities, and breath holding. And no exercise should be undertaken during a vitreous hemorrhage. If the individual has vitreous hemorrhage, any kind of exercise is not recommended. Those who have cataracts, definitely they have difficulty in visualizing distant objects, sometimes near also. So they should avoid activities that are more dangerous due to their limited vision, such as outdoor cycling particularly is very important, and they should consider the supervision for certain activities. What about kidney diseases? We have large group of patients, diabetes group, which those who have nephropathy, individuals with microalbuminuria, all activities are okay, but vigorous exercise, here point is to be noted, vigorous exercise should be avoided the day before urine protein tests are performed, because exercise, particularly vigorous exercise, will cause false elevation in urinary protein and will give false positive reporting. So this was the recommendation for microalbuminuria. People with overt nephropathy, all activities are okay, but exercise should begin at a low intensity and volume if aerobic capacity and muscle functions are substantially reduced. People with end-stage renal disease, same thing applies. They should monitor electrolytes also regularly whenever they are doing exercise during dialysis sessions. What about diabetic patients who have nerve diseases like peripheral neuropathy or foot ulcers, amputation? Those individuals with peripheral neuropathy, they should properly take care of their feet to prevent foot ulcers and lower the risk of amputation. They should keep feet dry and use appropriate footwear and polyester or blend stocks. They should consider inclusion of more non-weight bearing activities, like swimming or cycling, if possible, particularly if gait is altered. Swimming and cycling, they are non-weight bearing activities, my friends. They don't put any heavy stress. Local foot deformity people, they should also focus more on non-weight bearing activities like cycling to reduce the unwanted extra plantar pressures. They should also examine feet daily to detect and treat blisters, sores or ulcers early. What about people, diabetic people who have foot ulcers and amputations? Similarly, they should avoid weight-bearing activities, and they should examine feet daily to detect and treat blisters, sores, ulcers. Amputation sites should be properly cared daily, and they should avoid jogging, of course. Arthritis is a very common problem we see in diabetic patients. The recommendations are most low and moderate intensity activities are advised, but more non-weight bearing or low impact exercises taken to reduce stress on joints. Range of motion activities like stretching and light resistance exercise, they are advisable to increase the strength of muscles surrounding the affected joints. And activities with high risk of joint trauma, such as contact sports like and ones with rapid directional changes like soccer, hockey, table tennis, boxing, they put instant and dramatic pressure over the joints. Those activities should be avoided by the individuals who have arthritis. So, my dear friends, the take-home message is both physical activity and exercise. They are crucial for people with diabetes, and every diabetic patient should adopt. They should activities should be tailored, man-made, patient-made to meet the specific needs of each individual. 150 minutes or more of moderate to high intensity aerobic activity per week, 2 to 3 sessions per week of resistance exercise on non-consecutive days, and prolonged sitting should be interrupted every 30 minutes for good blood glucose control. Similarly, flexibility training and balance training, they should be recommended 2 to 3 times per week for older individuals with diabetes. mind this, for older individuals and diabetes, they are recommending stretching and balance training, not for the people less than 35 or 30. Then behavior change strategies, they can be used to promote the acceptance of adoption and maintenance of lifetime physical activity. So this was all about the physical activity guidelines, recommendations by the American Diabetes Association. So this was all about it. Thank you very much for patient listening. Thank you.
Thank you very much, sir, for giving valuable time. Sir, I have pasted some questions in chat box, sir.
Okay.
Sir, the first question is,
Yeah.
which fruits should we avoid in diabetes?
Usually those fruits which have very high glycemic index, those fruits which have the chances of increasing the blood sugar rapidly, like mangoes, grapes, bananas, particularly ripe bananas, and custard apples. These fruits should be avoided. Yeah. Some citrus fruits can be consumed.
And so, the second question is, what precautions should diabetic patient take while traveling?
During traveling, they should particularly focus whether they are carrying medicines with them or not. They should focus on their uh, dietary pattern, whether they have short-acting carbohydrates with them or not. In case of hypoglycemia, they should carry ID card of diabetes, and if it is a long journey, they should get their HbA1c, blood sugar level checked before the traveling, and after arriving at the destination, they should again check the blood sugar levels, and if needed, they should try to be in touch with their consulting diabetologist. Yeah.
So, next question is, every diabetes patient need insulin after some year of treatment?
No. It's not every patient. Exactly, we can't answer this question because so many patients. There is no data that percentage-wise how many people they will end up taking the insulin. So most of the patients, when they don't need insulin, if they properly follow the guidelines. Some patients, if they have genetic background or type 1 diabetic patient, they need insulin.
Sir, next question, sugar versus sugar-free tablets versus jaggery in our daily use.
See, jaggery it is not like that jaggery will not increase the blood sugar. Jaggery, in terms of glycemic index, it is equal to blood sugar, equal to sucrose, cane sugar. So, if you are very much worried about blood glucose level, then jaggery should be avoided. Safe sugar-free options you can take, you can accept. Steviana, I will recommend. Steviana sugar-free is relatively safe. Jaggery may have some nutritional value, may have some minerals, vitamins in that, but as far as blood sugar elevation is concerned, it is equal to sucrose. Stevia and sugar-free I will prefer.
Thanks, sir. Thanks for giving valuable time, sir.
Thank you very much. Thank you very much. Thank you.
Technical team. Hello. Thank you, sir. We are offline now.
Thank you very much.
Thank you.
Thank you.
Should I